So, Professor Amanda Amos, welcome back to Ash Scotland.
Thank
You're
you.
a long-standing friend of the organisation, and you have seen so much history and progression in the whole field of tobacco control. So, can I take you back to when you first came into this area of work
Right.
and tell me what it was like?
Well, it's way back in the 80s. I was doing a master's in public health, and my supervisor was Mike Daub, who I believe you've also interviewed. And I did my research on women's magazines, because at that time it was the source of information on health for women. And I was appalled to find that they all took tobacco ads, but gave absolutely no coverage to the health effects. And then it was, and it still is, the number one preventable cause of death in women. And I actually interviewed some of the health editors who were... that got me angry, and Mike encouraged me to continue that. And I carried on doing research on women's magazines and tobacco policies in Europe. But it was that anger about this tobacco industry, because I'd never smoked. It wasn't anything that was on my... I got so angry. What are they doing targeting women and young women? So I got lectureship at Edinburgh University in 1985. And of course, I'd already got links with Ash Scotland. And at that time, it was the wonderful Lady Eileen Crofton and Alison Hillhouse. And they were in one room on Queen Street. And they were so supportive. And I think one of the things I'd really like to emphasise is the way that Ash Scotland was ahead of the time, innovative, creative in terms of using research and working with researchers. And we're going to be talking about some of the actual collaborative research. It wasn't just, oh, what are you researching on and what are you finding? It was actually, we'll be part of this. And I think that's a hallmark as well of tobacco control in Scotland, that we work together across different sectors and trust each other and support each other. So that's been great. So at that time, I mean, I think it's difficult for people who weren't around in the 80s to realise how pervasive tobacco advertising was, how powerful the tobacco industries were. So every small corner shop, the windows were plastered. They actually had these ads that covered, I don't know if you remember those, I'm sure you do, covered the windows. Often you couldn't see through the window because there was this massive ad. So what we were trying to do then, because the governments were just not interested in tobacco control, it was seen as very much victim blaming. It was, well, if you smoke, it's your fault and it's up to you to quit. And young people don't start because that's really stupid. Well, yeah, right. So we were trying to push to get some action. So at that time, it was the Advertising Standards Authority and this committee, Comitas, on tobacco advertising. We used to call them comatose. So we would be sending in all the time examples of, they had these rules, breaches, we used to call them breaches, just to try and push it. So the first research project I actually did as an academic in Edinburgh was with Ash Scotland and with Lothian Health Education Department, Graham Robertson. So Alison, Graham, me. And it was looking at, so we thought young people, and I've always, the themes that have informed my research have been young people, women and inequalities. So we said, this is ridiculous. Young people, they go to school and they're surrounded by these tobacco ads in the little shops where they go and buy their sweets and also buy their cigarettes. And so we did this very small study around Edinburgh, looking at the levels of advertising within so many 100 yards of every school in Edinburgh. And then we sent this all off. And we actually got peer-reviewed publications from it to show and just chip away young people being targeted, because it was just seen as the norm, as we've seen subsequently, that we used to think big point of sale displays in shops were completely normal. And it's only when you go, what? Why? So that was very much about trying to get push. And we got one success was getting tobacco ads taken out of young women's magazines. But it was very slow. And so kept on going on that. And then as we moved into the 90s, I suppose I was very interested, because I'd always been interested in women's issues, about the lack of any work to support women to quit smoking, because of course the NHS smoking cessation services were nowhere. They didn't come in for another 10-15 years. So there was hardly any support. And also the support that was the media campaigns, you know, the real victim blame, those awful ads of the pregnant woman holding the cigarette. How dare, you know, you want to risk the life of your child? The complete opposite of empowering. I'm just making women feel worse about themselves, because no woman wanted, of course, to hurt her baby. So we, with Ash Scotland, we were very keen to promote new ways of working on women and smoking, particularly disadvantaged women. And Hilary Graham's work in England many years before had started to break that open. Why do women smoke? Particularly, why do women in disadvantage, in poverty, smoke? When it's not only affecting their own health, but they're spending enormous amounts of money on it, which obviously could be used for other things. So we had this wizzo idea of, well, it's seen as victim blaming. If you talk about women and smoking at that time, it was very much seen telling women off. And the real sense we had was we wanted to do a very much grounded, community-based approach, that people working at community level just wouldn't talk about smoking because they felt it was telling women off. There was nothing much they could do to help them. So we thought, hang on, could we actually build partnerships with people working at the community level? So with Ash Scotland, we had a little small pilot project called Under a Cloud, yes, Under a Cloud. This was 94, and which involved interviewing people working at the community level, and actually found out that they would, if smoking was addressed in a way that was supportive of women, they would be very interested in developing new approaches. So then with Ash Scotland and us, we got money, I think, from HEBS. Was it HEBS? Mm-hmm. HEBS at that time, the Health Education Board for Scotland, which is now Health Scotland, to do the first ever community-based projects on women, low income and smoking. And the idea was that projects could bid in for small amounts of money to do whatever they wanted to help women quit or to reduce their smoking. And we wanted this really open approach, so I remember it went from everything, and of course smoke free hadn't come in there. So I remember one project was to pay to redecorate one room, and that would be the no smoking room. I remember there was something about keeping your hands busy in a community project, and that they wouldn't smoke while they were doing their knitting these sound now so small, but it was just to try and help women see that they could break. And there was some more standard cessation approaches. But what was great about that was there was a full-time worker in Paula Gaunt Richardson, mm-hmm. in Ash Scotland, who supported these community projects, and also academics involved, and we helped them evaluate. And again, we said, we'll let you do different ways of doing it. It's not just how many have quit, it's have you helped raise the issue of women, move it on, and Ash Scotland produced a really nice evaluation booklet that I still used to use with master students, because people were terrified at the community level. Oh, if you say the word evaluation. But we were always saying, but we've got to build the evidence base. So if you're going to fund projects, you need to then learn and formally learn. And we got, with Ash Scotland, several peer-reviewed publications out of that. And that was the first ever approach like this in Europe. It really inspired people across Europe, because then we were starting to get Europe Against Cancer. People were starting to work across Europe, and Ash Scotland played a really important role in that. And that's when we got involved in the International Network of Women Against Tobacco.
Tell me more about that.
Yes,
it was real kind of feminist mark on health almost,
it was amazing. So it was the 1990 World Conference in Perth, Australia. And before that, it was like, there's nothing on women, there's nothing on inequalities. And I've forgotten who organised it, but there was a pre-conference one day of just some workshops on women and smoking. And it was fantastic. This has never been done before. Because the idea of gender approach, oh my gosh, we weren't even talking about gender then. That there might be different reasons why women smoke, because it was, of course, very medical model. It was nicotine addiction, the idea that was this also to do with your social circumstances, with the meaning that smoking had for you, that your identity, which of course the tobacco industry knew all about because their marketing pushed all this. Create, any image you want to create, we've got the right cigarette for you.
They've done that right throughout, haven't they?
They've done that right throughout.
They've targeted minority ethnic groups,
Yep.
They've targeted women,
Yep.
They've targeted
And
young people.
And in the 80s and 90s, what you saw was the tobacco companies spreading across the world targeting women, which of course got very much involved with Judith Mackay on this. And so, in the 80s, like in Spain, very few women smoked. And you just saw these ads just so blatantly targeted, which is why I did my research on women's magazines in Europe, because you could track this happening.
They sold it as empowering, didn't they?
Absolutely. They used the language of feminism and empowerment. And of course, a country like Spain was coming out of fascism, post-Franco. This was just what women wanted. And, that old slogan back in the 20s, that your cigarette was your torch of freedom.
Yes.
That was the phrase they actually used. And here they were 60 odd years later, exactly the same. So in what was... became important to Ash Scotland because we got so angry at Perth that we met in somebody's hotel room one night and says we've got to do something about raising issues around women and smoking, and set up INWHAT. And what then happened was that in Europe we said, and Ash Scotland was a key part of this, let's see if we can get some money out of the European Commission to set up a network in Europe. And support, so it was about not only raising the issues of women and smoking and young girls in Europe, but supporting women working in tobacco control. And we did, and it was based at Ash Scotland. And that was 3 years, I think. And at that time, so we had somebody, a full-time worker, who had several languages. But in fact, that's not the way it went. It became much more of a networking through newsletters, through meeting at those days you could meet at meetings, supporting women, getting to know women in different countries, that real mentoring, advocacy training. And I was the evaluator on the INWHAT Europe project, and then it just created a life of its own with very little money. But we produced some groundbreaking reports on women, on different aspects of women and smoking, marketing, inequalities, that again had never been done. And that was a great time because there was a real European people really exchanging information and learning from each other. So again, Ash Scotland played a key role in that. And that again reflected the networks that Alison Hillhouse and others had built over the years. So like with Margareta Haglund in Sweden, who was tobacco control in Sweden, and these senior women, Martina in Germany, key people, Elizabeth Tamang, who's still head of INWHAT Europe. So again, Ash Scotland. So that was a whole new way of working. So we really did shift it, I think, away from the victim blaming, and also looking at inequalities and really targeting, getting the European Commission, tobacco advertising, and as we started then to see things changing at the policy level. And of course in Britain it was the Labour government coming in, and 97, the first ever white paper. That is a national UK strategy on tobacco, the first time. And it had teeth. It wasn't just, well, we might like to do this. Because, we forget that in the 1980s, up until the 1990s, there was no decline in youth smoking in Britain. And this idea that it would just sort of decline, well, no, it wasn't, because nothing was going on other than Scotland and some academics and people in the rest of Britain going, chipping away at it. So that was transformational when because we could work with and of course this was before there was a Scottish Parliament. We could work with the government then. So and lots of exciting things then happened, as we know, at the national level, and tobacco advertising particularly stopped, and packaging issues. So the next thing that we came onto, of course, was smoke-free. Mm-hmm. And again, it was that, breathing in other people's smoke just was never an issue, was it? You go to a pub, you come back stinking, and that was the norm. And so this evidence had been around for quite a while, particularly from Japan, because they were able to do the classic study, because there was massive high rates in men and hardly any women smoked. So they could compare, they could look at what was happening to women's health who lived with a smoker, and saw these major impacts, and started to get out what I used to call creative epidemiology, where you use boring epidemiological data to say, well, actually, what was it at that time? How many tens of thousands of people are dying? 10% of deaths in Britain from smoking are in non-smokers. It's from so that was, and of course, actually that's then when we had separate parliaments.
Yeah, it was about that time.
It was about that
and
time.
Scotland took forward the marketing restrictions.
So this then became a really interesting dimension, which we hadn't seen before, of the four nations. Could you work in, as we'd seen in Europe, and also Canada coming in, because Canada had been really progressive on a lot of things, countries playing off each and say, well, we can do better than them. And of course, it was Ireland, wasn't it? So we were like, Ireland, they're bringing in smoke-free. They're a small country. Surely Scotland wants to be the best small country in the world. Can't we do? And the Irish were incredibly supportive, weren't they, in the evidence and in the arguments, and because this was seen as, oh my gosh. And as we know, the British Health Minister, who was Scottish, saying he was against it.
Civilizational collapse. All the pubs are going out of business.
And it was, we had the same rhetoric. This is the poor's only pleasure. Which the British Health Minister said. It's my mother who lives in Glasgow's only pleasure. And we'd shown through our work with women in Scotland, no, women didn't want to smoke. They wanted the last thing they wanted was their children to start smoking. So the smoke-free was so exciting.
And we shifted the rhetoric from being about the person to being about the product and its effects.
Yes. Yeah. I always remember it was it a cancer cancer media campaign which had a picture of a woman working in a bar saying working shouldn't be a death sentence, and it was like, what? And it's like, and I think what they worked out was it like 3 people were dying a week who'd worked in hospitality, who'd been, so again it was using figures which I think we'll come back to about smoke-free homes in a way that captures the public, that completely reframes. So it's not about the freedom of smokers to smoke, it's the freedom of anybody not to be exposed to their smoke. So that was very exciting, and really, I never thought we'd see, because it re-energized, didn't it? Alliances again came together.
In the course of about 6 years, it went from the media not wanting to know, it's not an issue, politicians saying it'll never happen, the licensed trade start to go, oh no, you can't do that because we depend on it, to Ireland saying, we care about our bar workers, and Scotland's First Minister going over to Ireland and going, they're very like us, it can work here.
It can work. And because I was involved with Sally Hoare and others in the Scottish evaluation, which was the best in the world.
Brilliant.
Because it was multifaceted. It looked at all the different elements, quantitative and qualitative. Did a portfolio really of different studies. Brilliant. And so it was able to capture the health impacts that nobody'd ever thought of, like reduction in premature births. What? But also, because we were involved in the qualitative, we took 2 affluent communities and 2 disadvantaged communities and did interviews, and also sitting in bars and pubs before and after to see the effect. It was self-regulated. That was from day one. People got it. And yes, they were trying to, because I always remember it was always a thing about put the cigarette in your mouth before you leave the bar, as a little statement of, but it completely, people
got the arguments.
They got the
didn't they?
argument.
Yeah.
And so that was very exciting. But of course, one of the concerns have been that if you stop smoking in public places, people will smoke at home, and the health impact could be minimal, and it'd be children that would suffer. So there wasn't much evidence of that, but that's when
We couldn't answer that question. So we had to say, well, we don't know. Let's do something to stop that. Yeah.
So again, it was this was around in the noughties, yeah. The National Lottery had a fund for NGOs to apply for to increase their research capacity and expertise, and you were very involved. So Ash Scotland went, yeah, and so we thought, well, what about smoking in the home? And brought together, again, really creatively, different academics with, so wonderful Sean Semple, who is the air quality guru, Steve Turner, who's a paediatrician, myself, who's a qualitative researcher, and did different elements of looking at the evidence, systematic reviews, but also said, how might we, again, have an empowering approach that helps particularly disadvantaged smokers reduce the smoke in their home. So with this idea of using these air quality monitors that have never been used, they were used in labs and things, we thought, well, why, if we give people evidence, so again, it was very much an empowering approach, if they have evidence about their own situation, that could be useful to them, not only in maybe helping their own smoking, but in the family, looking at, this is the effect it's having. So that was a pilot project. This is Refresh, which up in Aberdeen, and it actually looked at, well, would people be interested in having these machines in their home? And then you produce graphs and you compared to what the WHO said was a safe level. How did people respond? Particularly it was mothers, because they still do most of the caring at home. And it was really powerful. So it was before and after, that actually people wanted this information. They understood it. They were given feedback. And also that there was no evidence that smoking was transposed into the home. If anything, I think it went down because people had got the message.
People were walking between pubs and smoking rather than sitting in the same place.
And going out. But what it did, and then so Ash led that. Ash Scotland led that. And then it led to several other studies that I was involved with Sean and other people. Actually trying to refine that. We did a trial to see, well, would it actually reduce exposure? Also, we were working with very disadvantaged young women who had babies quite young. So a whole range of different projects. What it led to, I think, was us more about understanding about the constraints. So it's the inequalities themes, the constraints on particularly women reducing smoking in the home. Of course, if you live in a flat, there's no outside area, there's no one to look after your kid while you go for a smoke. So again, trying to think, well, and this was great because I mentioned the partnerships in Scotland, not just with the with Ash Scotland and the government, and the local health boards, but working with practitioners on the ground, feeding this information back, saying, well, how might you as a community nurse or work support as a health visitor support? So really very very creative, and that led to influencing very much the approach the Scottish government took in their media campaigns. So by understanding what were people actually doing in the home, which we didn't know before, what they thought worked, which we knew didn't, like smoking out of a window, or waiting until the children went to bed. that we could advise the Scottish Government about how to have a more constructive and effective approach, and that led to the Take It Outside campaign, that actually any smoke in the home lingers. And that was Sean Semple's wonderful interpretation of his data, that smoking lasts for 5 hours in the home. And that was completely new to me. People thought, because the ads before had these swirling little wisps of smoke, the idea that 5 hours, and that was really powerful, I think, in changing the approach. So and has continued, I think, concerns about, yes, smoking's really gone down in the home, but of course it's still in the most disadvantaged communities, so there's still quite a bit of work to do there.
Absolutely, and because it's invisible and you can't smell it and see it, you don't know it's there.
No.
And it's still doing the damage.
It's still doing the damage, yeah.
And talking about still doing the damage, and going back to the tobacco industry, and its interest in addiction and the next generation. Can you tell me kind of what you've learned from your research about young people and tobacco and addiction, and where you think we are at the moment?
Well, we did, I was actually thinking with Alison Hillhouse, did the first ever report on smoking in Scotland in around about 1990. Nobody had ever put the data together. And looking, I was then commissioned by the British government to look at the influences on youth smoking from the evidence. And I talked about, there's things to do with the individual, things to do with their family and social environment and their friends, and then the much wider, which is the marketing, the price, availability. And each of those layers has an effect. So, of course, if you grow up in a home where smoking, your parents smoke, the people around you smoke, it's easy to get hold of tobacco, even though the age of sale, we know, the increasing to 18 did have an impact, but young people can still get hold of tobacco. Same with vaping, which I'm sure we'll come on to. So it's how you need to affect all these different levels, because a young person starts to smoke because not necessarily consciously, but think, what's this going to do for me? And it could be, well, this makes me look older, this makes me look cool. So where do they get those images from? And they're still in the media, nothing like how they used to be, in films and social media and doing things. But it's that image. And then it's also the messages they get, the information they get about, well, why shouldn't you smoke? That is important. But also, can they get hold of it? Is it accessible? That's the price? Does the local shop? Or can they buy in schools? And we did a European study, and it turns out Britain seems quite different. Kids selling cigarettes to each other in school, and singles, and so is it what your mates do? Is it a way? And then, of course, we know addiction kicks in at much lower levels than anybody thinks. And Anne McNeil's work in the 80s showed that, just 1 or 2 cigarettes a day, and you're getting addicted to nicotine. And then they start to think, well, it helps me. It'll help me with my exam stress. It'll help me when I'm bored, and of course we know that a lot of that is to do with nicotine, that it's the withdrawal symptoms, and then you have a cigarette and you feel calmer. So we used to try and do a lot about, young people need other skills to help them through adolescence, not a cigarette. So it's also what's around in the wider environment. That's why Smoke Free was so important, that they weren't seeing people smoking. And although people said, but they create these lovely places outside pubs where you can smoke, or when you go out of the nightclub, it diminished the power of the image of smoking. So I was particularly interested in young adults, so 18 to 25, which have been a very under-researched group, because it's like, well, what happens when you leave school? And what is it that switches somebody from maybe quite a low smoker to then becoming a regular adult smoker? And things were like the sorts of jobs some young people have. That's the only way you can get a break still, is to say, well, I need to go out and have a cigarette. So again, it's about understanding young people's worlds as well as the addiction, and how to tackle that as well.
And the industry's always made a point of understanding their worlds and the image making.
Absolutely. And I remember when we were doing several studies, particularly Display, which was the big longitudinal study on the impact of the ban of point of sale advertising in shops. that we thought the industry would try and get hold of our data, because they are not supposed to do research with young people, and so our focus group data and stuff they would have loved it, but we know there's other ways that they find out what's going on, and to some extent, well, certainly when we go back into we're way ahead of us in terms of their understanding, and of course they don't have the ethical considerations that we in public health have.
Because what I see now is the kind of e-cigarettes that are in your face, in shops, in shop windows, are the brightly coloured, sweetie flavoured, very cheap disposables that are predominantly used underage by children. We were doing so well. Smoking rates in the 13 to 15 year olds is, we're down. Could barely measure it in Scotland before lockdown. And they weren't interested in e-cigarettes. So the research we were doing as part of Display showed that. And I did some research, particularly Juul was the big e-cigarette in America and had taken America by storm. Scottish kids just weren't interested, and it was because it was too expensive. They didn't see the added value of having it. We have controls on nicotine levels in e-cigarettes, so they weren't getting the hit that they did in America. Weren't interested. And now look. So what a surprise. The market created the perfect product for young people, which is cheap, disposable, colourful, and it's become a thing. And we've seen this again and again. The tobacco, nicotine market, however you want, will create, of course they do, that's the survival, products that appeal. And I think I'm very worried about, and have been right since e-cigarettes appeared, about what the impact on young people might be. Of course they can help adults quit, but if young people take them up, what does that mean? Because we know from research that if you start vaping, it certainly increases your chance of becoming a smoker, as well as, I think, I mentioned ethics there, but we don't want young people addicted to something, nicotine, that they don't need to, and they're spending money on it. And again, if concerned about inequalities, what that might mean. But I think what I'm seeing compared to the research we did a few years ago is that vaping is even more your flexible friend, which we used to call cigarettes, that you could smoke whenever, however you're feeling it, up, down. Vaping, because they can do it in school, and have a quick, that we're hearing awful things about before lunch. Some young people getting really quite agitated because they need their nicotine hit. They can do it throughout the day, whereas in the past, smoking, you had to wait till there were breaks, so there was some sort of restriction. Now, and I don't know what the evidence is on what the levels of nicotine are that some people are because that's the other thing. I mean, we did research with young adults around e-cigarettes, and one of their concerns was, I never know when to stop with an e-cigarette. With a cigarette, you smoke, you put it away, and you won't have another one. Vaping, you just keep going because you don't have those same triggers or indicators. So I'm very concerned, and at this point in time when we're doing this interview, I just think disposable vapes should be banned, environmentally as much, but also because we have now, this can of worms has been opened. We've gone from incredibly low levels of smoking amongst young people. We really thought we'd been successful, and who knows now, in 10 years' time, what will the rates be, particularly in young adults, as they leave school. And can we say this is a passing phase? It doesn't look like it. It looks like once they start, of course, because they get the nicotine, and the ways of smoking vapes, you can get really high hits. And again, they're just, I think that's also, I'll just say finally on this, that the education. So I'm on the board of Fast Forward, and Fast Forward is a Scottish youth charity, and I know Ash Scotland's been finding the same, that the schools are coming to Ash
to fast forward, I'm sure they are to you, saying, we don't know what to do. What's the facts? What's the education? Because we know that education on smoking and tobacco had really declined because people thought, oh, well, we've done that. So young people have very low awareness about the risks of smoking, but vaping even more so, that because of these flavours and the brightly coloured, which was exactly, we had a paper published about the display where one young purple said they're like adult sweetie shops. That's when cigarettes were displayed. Well, that's exactly now what these products, the disposable cigarettes, because they're all colourful. And personally, I think that if they were banned, it's not going to stop adult smokers who want to quit using e-cigarettes. There are plenty of different types and much better products. But for young people, I think this is, we're really in worrying territory. And I know Ash Scotland has also been concerned about this for years. And unfortunately, it's come to pass.
Yeah, I think we did have concerns that this might happen. In the last couple of years, we've seen a skyrocketing uptake in children and young people. And these things turning up in primary schools. Yeah. We haven't heard many reports about cigarettes in primary schools for a long time.
And like I say, fast forward, we're having requests from primary schools to do. And yeah, it's very worrying. And of course, that's where the social media come in, because we now know that advertising mark bans, but controlling what's on social media, it's very difficult.
Very difficult and very targeted to ages.
Yeah, so you've got to raise awareness in other ways. Yeah.
So look, then, just from our conversation, I think we looked back and we've seen that there's been huge progress, that
enormous
smoke-free indoor places are now regarded as normal. And people in, after it came in Scotland in March 2006, people were going down to England and there was smoking in hotel lobbies, and they were finding it really strange because they got used to not having it. And their legislation came in July 2007. So we make incremental progress. What looks impossible becomes
suddenly
the norm.
Yes. But there's a lot of work that goes behind that. And, the 80s and 90s when Ash Scotland and others were just hammering away there trying to... So it means that when particularly the policymakers, the politicians come in who get it, you can then really speed forward. So the advocacy work and and of course you have to keep refreshing that, don't you? As ministers change, as civil servants change, you can never rest on your laurels. So you've got to keep going. And then you see these what seem to be apparently fantastic sudden leaps in policy. But there's usually years of work have gone behind that.
Yes, and I think with Ash Scotland, working in partnerships, steadily working along with the evidence, working with colleagues in a wide range of fields.
Being trusted and respected.
Yeah. So any advice for us going forward?
Well, hang in there. I think it's we're back into a period of, well, not quite austerity, but but we've been there before. Very little money, having to be even more creative and innovative and nimble. That word, with the resources one has, building those relationships with, seeing it's a win-win, and so it's that reframing, isn't it? How do you present things in a way that people go, yeah, I can support that. No, I'm not going to lose votes. No, this is worth, or I want to do this anyway, and it can be done. And still learning from other countries and using evidence from other countries that say, well, look, New Zealand's done this, or somewhere else, and the world hasn't collapsed. Not necessarily easy, but we can do it. So yes, keep going.
Thank you. That's a good positive message.
But I hope you're not still here in 50 years.
Well, us too.
Yes, yeah.
But thank you for all the contributions that you've made to this field over the years you've been working in it, and for the spotlight you've put on people that are seldom heard. And I think that's important, and that's one of the legacies that Ash Scotland's carrying forward.
Great.
So Professor Amanda Amos, thank you so much for your time and for talking us through some of those decades of work that have got us to where we are now.
Yeah, thank you. It's been a pleasure. Thank you.